Hello, my name is Andrew Way from the Department of Haematology at the Alfred Hospital, and I'd like to thank the organising committee for selecting this paper for the award, which was a publication in the New England Journal of Medicine. Let me start by introducing that acute myeloid leukemia is an aggressive blood cancer which is almost universally fatal if not in receipt of effective treatment very quickly. As you can see here, the three objectives of therapy in acute myeloid leukemia are firstly to achieve remission, to try and reduce the risk of patients dying from infections and bleeding complications. The second is to eliminate measurable residual disease, because relapse after remission induction is very common because of the survival of progenitor cells and also resistant blasts, which can seed clinical relapse. And the third objective is obviously to treat patients with resistant disease with salvage therapies. As you can see, over the last few years, there have been a number of new therapies approved by the FDA in the US for remission induction and also salvage of leukemia. However, the middle part, which is maintenance therapy to eliminate measurable residual disease, there have been no indications prior to this clinical trial. And so the problem that we faced at the beginning of this clinical trial endeavour was that there was a high relapse rate without allogeneic stem cell transplant. And unfortunately, transplantation is not always available to all patients, particularly older patients who are at higher risk for complications from transplant. Second, over many decades, there has been failure of previous maintenance trials to improve overall survival amongst patients with AML. And the third problem is that we really needed a convenient and minimally toxic post-remission therapy in order for this to be a viable maintenance therapy. And so this trial was focused on a new drug called oral azacitidine, which is an oral formulation of a hypomethylating agent, which was proposed to reprogram progenitor and AML cells epigenetically and reduce the chance of disease progression and prolong remission. And so an international phase 3 trial was initiated in 148 sites in 23 countries around the world. The target population were patients with AML aged 55 years or older, and the median age of the study population was 68. Patients were enrolled in first remission within 120 days of achieving remission, so as to not enroll patients that had a lower chance of relapse if they were enrolled beyond that period. The treatment was oral azacitidine, delivered as a tablet at a dose of 300 milligrams for 14 days, each 28-day cycle, and there was a one-to-one randomization to placebo. In the study, there were a median of 12 cycles of oral azacitidine delivered, with some patients receiving at least 80 cycles of therapy, indicating the very high tolerance in relation to this therapy. In all, there were 472 patients enrolled to either the oral azacitidine or the placebo arm. The primary endpoint was overall survival, and with a median follow-up of 41 months, oral azacitidine led to a significant improvement in overall survival for patients with AML from 15 months to almost 25 months, with a p-value less than 0.001. This translated to a 2-year overall survival benefit being increased from 37% at 2 years to 51% for patients receiving oral azacitidine. In terms of the overall outcomes for this study, this was the first maintenance therapy to ever show a survival benefit in the history of AML clinical research. This study led to FDA approval of oral azacitidine in September 2020 and now represents a new international standard of care for patients with AML in first remission. Oral azacitidine, because of the convenience of its oral formulation, has huge potential to be a new backbone for numerous therapeutic combinations, with many of the drugs listed as being FDA approved in first line and also in the salvage setting. And lastly, the oral and convenient nature of oral azacitidine has potential to replace multi-cycle consolidation chemotherapy in the future for patients' AML, making treatment more convenient and less toxic and associated with less hospitalization. So in conclusion, I'd like to thank again the committee for selecting our paper for this award, and we're very privileged to be associated with the Alfred Hospital, which was the leader for this study internationally. Thank you.